Dr. Sarfaraj Majid, a physician and diabetologist from Kolkata. Today, I'll be discussing a very important topic, that is hypertension, to understand what hypertension is and how to manage it. You know that generally everyone would like to have a healthy or a normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels, and this creates a pressure against the wall of blood pressure. This is what we call blood pressure. So the pressure that is exerted by blood into the artery is called blood pressure. So normally in healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer period of time, it lead into injuries like health complication. In general, persistent increase in blood pressures higher than normal blood pressure is known as hypertension. So generally, normal blood pressure for an average individual is around 120/80. So blood pressure has a two component basically: systolic blood pressure, which is generally the higher, and the diastolic blood pressure, which is lower. So the two components are 120/80. The 120 is the systolic blood pressure, and the 80 is the diastolic blood pressure. So high blood pressure usually develops in due course of time. It can happen because of unhealthy lifestyle. For example, not doing enough exercise, obesity, smoking, alcohol consumptions, or stress. There are other risk factors as well, like family history, age. Elderly peoples have more higher blood pressures. Taking excess of salt, that also causes increase in blood pressures. Not eating healthy food, taking high amount of calorigenic fatty meals. So these are the things. Stress level, that also increases blood pressures. So moving on, hypertension does not have any obvious sign and symptoms, but when it is often called as a silent killer, it puts people at risk for several diseases, from cardiovascular problem, kidney failure, stroke, especially brain stroke, and even damage in the eyes, and it also causes blindness. So, so early diagnosis and accurate diagnosis of blood pressure is very important for better management, and that will help you to control and prevent any type of complications. Generally, we don't have a major symptoms, but you will have morning or anytime headache, tiredness, blurring of visions. Sometimes you will have excess fatigue, nausea, vomiting also. You will feel stress, especially in your cervical region. You will have muscle spasms, especially upper part of your body. You will have these kind of things. So in that cases, you try to check your blood pressure. So it is usually measured with an instrument called a sphygmomanometer. You must have seen in physicians or doctors' clinic. A blood pressure is recorded in two numbers, as I've told you. So normally healthy people have 120/80, and the range for systolic blood pressure is up to 140 is normal. Anything above 140 is high blood pressures. And for range for diastolic pressure is from 80 to 85 is abnormal. Anything above 85 of diastolic blood pressure is high blood pressure or hypertension. So anything above 140/85 is considered to be high blood pressure. But for elderly patient, that can be extended up to 150, and the lower part as 90. So normally to be more clinically more clear, we keep 140/90 as a cutoff mark. Anything above that should be treated. Not only that, for better awareness of hypertension and how it can be taken care and how it can be maintained. So every year, 17th of May is celebrated as a World Hypertension Day, which is dedicated to highlight the importance of monitoring of blood pressures and measuring your blood pressure and knowing your blood pressure, so that you can prevent any kind of unforeseen conditions. So risks which are there that can be easily prevented by changing few things, like acquiring a healthier lifestyle. You should go for regular cardio exercise, healthy diets. You should quit smoking or any kind of addictions like alcohol. You should regular monitor your blood pressures. If you have any kind of stress, you should go for stress management, and you should adhere to the medicine. If you are taking any kind of medicine, it's better that you adhere to that. If the blood pressure is successfully controlled with lifestyle modification, you may not require any medications. But in lifestyle modification, regular exercise or physical activity have a very important role. Exercise like cardio exercise like jogging, skipping, brisk walking, swimming. This helps in many ways in reducing your blood pressures. Healthy diet also plays a major role, and these two things are in our hand. Like a low salt diet, diets containing less trans fat, and it should less amount of red meats. You should go for a lean meats. If you're a non-vegetarian, take good amount of fruits, vegetables, whole grain vegetables. This helps in controlling blood pressure very well. There are different type of diets are there like DASH diet, Mediterranean diet, potassium supplement diet. So this helps in controlling blood pressure in a better way. And also intake of salt should be reduced. Salt intake should be reduced so that because salt generally causes increase in blood pressure. So you should be take as less as possible. If you have any kind of addictions like smoking or alcohol, you should avoid those things. Regular monitoring is very important. Even after doing all these things, still you find that your blood pressure is not under control, then you should consult your physicians and start a suitable medication which is sufficient for you for your better control. So overall, hypertension is a very manageable disease, and you need a little bit of awareness, little bit of monitoring. You need to change your lifestyle, try to reduce your change your food habit, do some regular exercise, and if required, take medication. You can control your blood pressures, and you can stay healthy and hearty. Thank you.